I then invite the CSO representative, Fifa A Rahman. Please, the floor is yours.
Thanks very much for the floor, John-Arne. On transition, we really look forward to seeing the transition plans on the global COVID response. And we second the comments by the ambassador from Germany earlier about the need with the sunset of the ACT-Accelerator to endorse some kind of mechanism for coordinating and evaluating the global response to COVID as essential, as does preparation for more severe and immune evasive variants. We second the emphasis by the Honourable Minister from Norway and also Joshua Taba from Canada about the emphasis on health systems, and ask that member states of the Facilitation Council advocate strongly for more resilient health systems, including community health systems, in response to future pandemics as well as this one. We'd also like to see further work on transparency in procurement during this transition phase, notably that an analysis on national policies be done and that recommendations are made to member states to ensure that transparent information is available about pricing, not just of vaccines, but also of therapeutics, PCR tests, and rapid antigen tests, and ensure that the governance system is in place to ensure compliance to transparency on procurement. We also ask that during this transition phase, Council members and member states strongly support civil society mechanisms incorporated within the governance of external mechanisms such as the Finance Intermediary Fund as a matter of best practice. On advancement of financing and uptake of COVID-19 tools, we see donors and governments really want to transition as well and focus on other diseases that are happening within their own context. But we still need a robust financial response towards the COVID pandemic, particularly within primary healthcare settings, and investments that support the integration of these, like Regina Osi has so eloquently mentioned earlier. In addition, we need investments that urgently support more ingrained issues rather than just sending commodities to certain countries. In the DRC, for example, we see health workers have not been paid for some time, and also nurses in North Kivu that are earning less than $80 a month. With only 14% of community health workers in Africa being salaried and 70% of those being women, these are really important issues to address, and we ask donors to focus on them. So to make the last point is that representing over 40 civil society groups in the ACT-Accelerator, we are convinced that the TRIPS agreement fails to meet our expectations as it does not deliver a meaningful global response to the pandemic and fails to uphold many key principles, including non-discriminatory treatment and equitable access to countermeasures and the benefits of scientific progress. The failure of this text to address IP barriers beyond patents and to deliver on diagnostics and therapeutics severely limits its effectiveness in increasing production and supplies. Our resources will go further when IP exclusivities are addressed. Thanks very much, John-Arne. Back to you.
Thank you very much, Fifa. I would like